Hi, my name is Karen and I want to talk about sundowning today. Sundowning is defined as a phenomenon which causes increased confusion and a change in behavior at a particular time of day. The time of day may not be the same for everyone, but regardless of the type of dementia, anyone can experience sundowning when they have a dementia diagnosis. They call it a phenomenon because although many studies have been done, there is not any study that has proven exactly what causes sundowning, but I have some of my own theories about what happens. Some of the behaviors that we see with sundowning are increased confusion, anxiety, agitation, exit seeking, wandering, and restlessness. Just not knowing what to do with themselves. If you work in a facility, what I've always called it is the magical hour of the day. A lot of people do experience this change in behavior or increased, for some people it's increased activity. For some people, they're a little happier, which is great. But we call it magical hour because it does happen at the same time of day for a lot of people, but not for everyone. And my theory is if you take into consideration what that person has done for the majority of their life, it makes a lot of sense why they would experience a change in their behavior at a particular time of day. And I want to give some examples of some cases of people who have experienced sundowning. Throughout life, as we age, as we grow, we live by our body's own life cycle, our body's cycle, and it's based largely on what our routine has been through our life. Most of us as an adult have an established routine. Whether you're a housewife, an office worker, a farmer, you've had a routine throughout the day that you followed. And when you are diagnosed with dementia and some of your responsibilities are no longer part of your daily life, this could explain why there is a change in behavior, why there is some anxiety. When you take into consideration what a housewife would have done during her life, she took care of her home, she took care of her children, she took care of her husband. When a person experiences sundowning, a lot of times it is when the sun's going down, somewhere between the hours of 3 o'clock and bedtime. And when you think about the housewife, what would she have been doing at 3 o'clock? Most housewives were waiting for their children to come home from school at that time of day. They might have been cleaning up the house and getting ready to prepare dinner, waiting for their husband to come home. So some of the behaviors that we see in a housewife at that time of day might be anxiety. They may be asking for loved ones. Where are my children? Where is my husband? They may just experience anxiety and restlessness because although all of their life or all of their married life and while they were taking care of children, they started preparing dinner at 4:30, 5 o'clock in the evening. Now they don't have that responsibility. They may not have a kitchen that they're allowed to work in. So they are wandering around, wondering what to do. It explains a lot about the confusion and the anxiety. One of the things that you can do to put them at ease is let them know that their children are okay. Their husband is on his way home or their husband is still at work. Give them something to do related to what they would have been doing at that time of day. Let them set the table. Let them help prepare the meal. One of the things I did with my Nana was I gave her a bag of potatoes, and even if I wasn't making mashed potatoes, I let her peel potatoes until she was content. So give them something to do related to what they would have been doing at that time of day. When you consider the person who worked in an office most of their life, you might see the behaviors change around the time of day they might have been leaving for work and on their way home. In a facility, a lot of times we've heard from the people who worked the 9-to-5 job at that time of day is, where's my car? Where's the bus stop? How do I get to the train? A lot of them get pretty angry because they can't find their car because they really want to go home. One of the things that you can do to put them at ease is get them into a nice, quiet, calm atmosphere. Give them their slippers, give them a newspaper, which is something they might have done when they've come home, and let them know what to expect. Let them know that dinner's going to be ready soon. That may put their mind at ease. When you consider somebody like a farmer, farmers live by different hours, depending on what kind of farming they've done. They may get up very, very early in the day and go to bed early. So you may see a different time of day for the change in behaviors. But when you consider what they would have been doing at that time of day, when you see the change in behavior, it makes a lot of sense. They would have been putting farm equipment away, maybe rounding up their livestock. So maybe talk about what they did for a living. Some people might worry that may bring on more anxiety, but for a lot of people who are proud of what they've done for a living, they love to talk about what they did. They were proud of what they did to earn a living. So talking about, what kind of farm did you have? What kind of vegetables did you grow? A lot of them will have a sense of pride, and talking about those things may bring down their anxiety level. There are things that we can do to sort of lessen some of the changes in behavior that we see at that time of day. If we keep note of what the routine has been and what time of day we see that change in behavior, especially if there is more anxiety or agitation at that time of day. If they have a medication that has been prescribed for anxiety, maybe we can give it to them an hour or so before that time of day. That's something that you would want to check with your doctor. There are things that we can do for them without medication. Giving them something to do with their hands. For the housewife, I talked about peeling potatoes, letting them set the table. Find out what their hobbies were. They may not be able to play chess or play cards like they once did, but you can sit down with them and talk about their hobby. Again, talking about something that they love to do may bring down their anxiety level. At that time of day when we see the change in behavior, keep the atmosphere calm. Keep the lighting not too bright, because sundowning usually happens towards the end of the day, so we don't want to keep them up at night. We want them to wind down their day. Because they have a dementia diagnosis, they may have lost the last 20, 30 to 40 years of their life. They don't remember that they have aged. In their mind, they still may be a housewife, waiting for children to come home, waiting for their husband to come home, needing to prepare dinner. As the breadwinner, the man coming home from work, of course he needs to find his car. He doesn't remember that he's lived in the home that he's in for the last 20 to 30, 40 years. That part of their memory is gone. So the best that we can do is figure out what time of the day these behaviors change or increase, and try to do what we can to keep them calm and happy and safe. Thanks for watching, and stay tuned for more caregiving tips.